over-the-counter mouthguards, end up actually using them like a chew toy. It can actually make the condition worse. The commercial is said, use our toothpaste and see your dentist twice a year. That's the scientific rationale for seeing a dentist every 6 months.
I suspect I clench or grind my teeth at night, but I have no idea how severe it is. Are there any devices or methods that can actually track this?
A lot of the antidepressants that are on the market, SSRIs, side effect is grinding. We actually have a device that helps reprogram those muscle activities. And so is that a cure? If you're grinding through retainers and things like that means you have a pretty serious grinding habit. Clenching and grinding isn't just about wear on teeth and sore jaws. And I've seen reports that say the side effect of lack of sleep is in the $200-300 billion range.
Thank you everyone for joining us. I have here with me Dr. Scott. Scott, thank you very much for being here. Yeah, we're going to be going through some patient or customer or user questions here from various online platforms. So, ready to start? Awesome. Thanks for being here.
Yeah, happy to.
First question is from Reddit. It says, I got myself a Shock Doctor Sport Easy Guard that I had to boil to fit my mouth. Will it help? How long do I have to wear it? Hopefully it will stop my teeth grinding habit because now one of my teeth is feeling loose.
You know, this is an interesting question, and I've heard this one so many times, and the answer actually is very dependent on the condition. And so people say, I've got a sports guard. These things that we buy at Target or Walmart or any of these places sell over-the-counter mouth guards are typically designed for sports. They're designed for sports protection. They're actually not designed for people that clench and grind, and a lot of them will even say that right on the package. And the problem is because they're soft, we boil them and then fit them into our mouth. Because they're soft, we end up actually using them like a chew toy. And so for people that have jaw pain, maybe from clenching their teeth, it can actually make the condition worse because they're now chewing on it all night long. So a lot of people wake up very sore. So it is kind of dependent on the condition.
Yes.
But the bottom line is, in that case, I would recommend you see a professional.
Yeah.
Or seek alternative therapies that are designed specifically for clenching and grinding.
Got it. Yeah, thank you. All right. The next question here comes from a user on Reddit. Says, I have the habit of chewing plastic. Even if I stop, my teeth are still somewhat bad. I have pains in my gums and my teeth sometimes feel like it's moving. Keep in mind, I do brush my teeth daily, mainly at night, so when I wake up, I like to get something to eat and drink. Anyways, is there anything I could do?
Yeah, something that's really easy. Stop chewing on plastic.
Yeah.
Our teeth are actually designed very specifically. And so when, like one of the things that is really actually bad for teeth is when we are like biting plastic edge to edge because our teeth aren't made to shear edge to edge like that. And so I see lots of broken and chipped teeth from people trying to do that.
Got it.
When I see people tear open a package with their teeth, all kinds of chipped teeth from that. So not the best application to do that. So I would encourage you to try and stop that habit.
Yes.
So any users that are using their teeth to bite things together or bite on plastics, please just find a way to get around that.
Right.
And then the second part of that, which I thought was interesting, is brushing your teeth once a day. I would really strongly encourage people to brush at least twice a day. And even more important in today's world in dental, and I know this is a little off the topic of clenching, but it is relevant, is to floss. Flossing will go further than anything by itself.
Got it.
And so we can keep our system healthy. Now back to the painful teeth and the clenching and the biting of those things. Is there a problem with that? And the answer is it can be multifactorial. So because our teeth aren't designed to hit end on end, sometimes we actually are dealing with cracked teeth. We see this in ice chompers, people that chew on the little unpopped popcorn kernels. We see a lot of broken teeth from things like that. And so when we are using our teeth in an unconventional manner, we do see side effects from that. It can be broken teeth, cracked teeth, sensitive teeth. And so the sensitivity that this user is experiencing could be from many things, and I can't see it without any type of official diagnosis, but a lot of times that can be a factor. Clenching can play a role because when we're compressing the ligaments, we're actually creating inflammation around the teeth.
Yeah.
And so it can make those teeth very uncomfortable.
Got it. So as long as we can get ourselves to know that we're doing it, we should not be chewing on plastic.
And that's where solutions that are proactive, that give us biofeedback, I think they're super critical because they actually can tell us when we're parafunctioning.
Yeah. Well, it's interesting because when I use my Zerine, I use Zerine, and I still do as needed. It actually gave me insight into what I was doing during the day.
Absolutely. In
ways that I didn't have before. And so just like what my jaw was doing. And so for those who may have habits that are invisible to them, they want to get insight into, there's ways to get some insight into those with technologies that we have available today.
And yes, absolutely. And when I first did my training with Zerine, which I found fascinating as a dentist to actually see in numbers what's happening at night, it was such an awareness that I hadn't experienced before. So super important. Yes, absolutely.
Awesome. Thank you.
Very cool.
Actually, just wanted to follow up. You mentioned brushing twice a day.
Yes.
And flossing.
Yes.
Just wanted to kind of, I think it's worthwhile hearing why you recommend twice a day at least, and then is it flossing once a day or twice a day that's recommended?
If we can do a minimum of once a day, that's good.
Okay.
Yeah.
Got it.
Yeah. And probably the most important time to do the flossing is before you go to bed, because we sit all night long.
Yeah.
And we are trying to clean the bacteria off of the teeth, especially in between. Yeah. Our toothbrush can hit the surfaces that we can touch with our finger, but it can't fit in between the teeth.
Yeah.
And so that's where flossing really plays a big role.
Right.
By the way, totally to go off on a tangent, because I know this is really important for us right now.
Yeah.
There is no biologic rationale for 6-month cleanings. When we had television commercials in the late 60s, early 70s, there was a commercial for a toothpaste company that said, use our toothpaste and see your dentist twice a year. That's the scientific rationale for seeing a dentist every 6 months for cleaning.
That's interesting.
So we actually prefer to base our interval for cleanings based on biology.
Yes.
And I had some patients that might be every 2 months. I had some that's 3, some were 4, some 6. I even had some that could make it 9 months without any problems. But it should be based on biology.
Got it. Well, thank you for letting me know and letting our audience know, because we want everyone to have the best solution for themselves, and it sounds like it needs to be tailored independently.
Yeah.
Actually, thank you. All right, moving on. Here's one. Is there a cure for bruxism? And I'm going to read this excerpt. It says, mine was due to extreme stress. I have not giving advice to anyone, but as I didn't have enough money to go to a doctor and all my guards kept getting destroyed, I started buying CBD oil, all legal and approved by the EU. And now I don't use guards. I have almost no migraines, and if I have one, it doesn't start when I wake up. Eventually, I stopped using the oil, but it lasts a lot. For me, at least, it's really helped with anxiety. I cannot say anything about any other benefits with anxiety or stress. It just really helped me. I don't know if it helps. If you don't want to try the oil, that's perfect, but you can try using magnesium. I've read that it relaxes the jaw muscles. I guess it may help the face muscles before sleep. So just wanted to kind of get your sense on kind of some of these biologics and over-the-counter elements.
This is a deep question, and it deals with, for some people, it's a controversial subject. For me, it's not at all. And there's a lot of misunderstanding about what CBD is. CBD stands for cannabidiol.
Okay.
And cannabidiol is a great anti-inflammatory, can be anti-anxiety, but it's not just CBD. And to be clear, we're talking about the extracts from either the marijuana or the hemp plant, but they do not contain the psychoactive ingredient of THC. So for people that are worried about those types of things, there is no psychotropic, psychoactive ingredients in these oils. They're very safe. They're very strong anti-inflammatories. But it's not just CBD. There's CBG, which stands for cannabigerol. This is great for people that are, mental clarity. There's CBN, which is cannabinol. It's actually great for helping sleep. CBC is cannabichromine, also a good product. CBG, cannabigerol, I already mentioned, but these are all things that can have a little bit different effects. Some can be a little more anti-anxiety, some can be more anti-inflammatory, some can be a little bit better for our mental health. But also when used in conjunction with each other, they can actually have a great impact on stress and anxiety, which a lot of us clench because of anxiety. And so, so absolutely, I'm really happy this person found a solution that works for them. We consider it a natural alternative because it comes from a natural plant. But we have to be careful with that because it's not appropriate for everyone. And so, yes, that can be effective, but it doesn't work for everybody. And some people are opposed to doing it. The other part of that question, by the way, just before we dig a little deeper, is was it magnesium they mentioned? So magnesium is a muscle relaxant of sorts. It can help with muscular issues. So another material that somebody could try if they want to reduce some of the clenching. Doesn't work for everybody, but it can have some impact. So all of these things together can work in unison.
I'm just curious, how would you, for folks out there that have experiencing a lot of bruxism and they want to try these potential alternatives to see if it may have a benefit, how is there a way to qualify whether it's helping or not? How is there a responsible way to do this, or a scientific way, or something?
There's a couple answers here. Number one is before you try anything like this, you should consult with a healthcare provider. Right? I mean, we just don't know what the side effects of everything are going to be, and every single person is going to be different.
Fair enough.
So some people might have a reaction to magnesium. Some people may have a reaction to the CBD line of products. And so I would always say it's probably better to have a discussion with a healthcare provider that can guide you appropriately. So use that as a backdrop. The second part of your question, you were saying?
I was just saying...
responsible?
How does one evaluate whether these are of having a benefit?
So there's two different things we can do. One is we can take it's almost like a quality of life assessment. It's a scored thing that says, how did you sleep, and a questionnaire that we can fill out. And there's all kinds of different versions, so I'm not going to really go down that path.
Fair enough.
But lots of different quality of life, quality of sleep, stress questionnaires. But for me as a clinician, one of the things that's really important is for me to have numbers that I can actually read. And this is why, for me, a product like Zerine is such a game changer. Because for the first time as a clinician, I can actually see the data from that person or that patient or the client's night of sleep, and I can see their stress points, and I can see how much they're activating those muscles at night. And I can also see the impact of those products. So I treat a lot of snoring types of things, and I want some type of app or device that can monitor that so that I can actually see if these things are being effective.
Right.
So to have a product that can actually measure those and actually give me quantified data, not just opinion, much, much, much more effective than subjective data.
Got it. Thank you for that. It seems like there's various options out there, and also ways to maximize the learnings from any assessments of these for everyone. But as you mentioned, the backdrop of consult a healthcare professional, make sure that it's a right something for but
again,
everyone.
Just to reemphasize, if I have quantified objective data, meaning it's not opinion, and I can quantify that with numbers, that kind of data is super helpful for me as a clinician.
Thank you. All right, moving on. Here's an interesting question. It says, how can I tell if I'm grinding my teeth at night? Is the headline here. Hey everyone, I suspect I clench or grind my teeth at night, but I have no idea how severe it is. I used to grind a lot in the past, and I think I might still be happening, but I sleep alone, so there's no one that can confirm it for me. So jaw soreness isn't as reliable of a sign for me since I chew gum a lot during the day. I've been thinking about getting a night guard, but I'm hesitant because I don't even know for sure if I am grinding. And as we know, night guards can be a bit pricey. Are there any devices or methods that can actually track this? I am also worried that if I get an expensive night guard, it won't help because I probably just chew through it. I feel like my bruxism might even get triggered by having something between my teeth to grind up. Any advice or recommendations? Well, maybe I can take this one. As somebody from Zerine, what Zerine does, as we've talked about in the past, is it evaluates what the severity of bruxism activity is. And so if you're out there and want to know whether you're grinding your teeth and want to have some numbers to kind of evaluate or to kind of assess what your grinding looks like night to night, Zerine's for you. You can feel free to hop onto our shop, purchase your Zerine, and then use it, and you'll have numbers. What's also interesting, what we're finding, Dr. Scott, is that people are using the numbers from the Zerine to then assess what parts of their life might be contributing to their bruxism.
Yeah,
so
great point.
We're finding some of the customers saying, gosh, when I drink a cup of coffee late at night, or have a few beers or what have you, I tend to have elevated activity. Now, I think it allows people who are curious about themselves to start to evaluate what choices they're making and how that affects their nightly sleep.
Yeah, this is actually a really interesting discussion to me because you brought up something that I think is really important for us to understand. There are a lot of things that I consider, and I want to use the word medicines, but it's not even just medicines. It's alcohol, it's caffeine that are stimulants. These are things that we know stimulate grinding response or lack of sleep. Maybe alcohol, not so much in the clenching department, but what most people don't think about are there's a lot of medications. The side effect is grinding.
Yes.
A lot of the antidepressants that are on the market, SSRIs, selective serotonin reuptake inhibitors, they create a lot of clenching response. And so we've seen a big problem. Now, we've kind of gone back down on the SSRIs, so we don't use them as much. So we've seen a little less clenching than we used to, but there are things we can do to add to those. So
yes.
if somebody's watching this and is using an SSRI for depression, I'm glad you found something that's helping you.
Right.
And you can talk to your healthcare professional because there are some things we can add to these. There's a little thing we call Buspar, which can be added.
Sorry, can you say that again?
Buspar, B-U-S-P-A-R, which can be added to it that can actually reduce the clenching response. A really common one, which is an illicit drug, is cocaine. A very strong grinding response after that. So a lot of these things can trigger these muscle contractions in the joints. And so we have to be careful with those types of things.
Yeah.
But back to your point, if we have a method of determining which of these seems to have a stronger response for us as an individual, we certainly should be using those types of things.
Right.
And to use Zerine, it's such a simple solution, and it's such a, in my opinion, very cost-effective solution. The cost, I want to address that for just a minute because for people that are true clenchers, the cost of replacing one tooth that cracked because we're clenching our teeth is going to be far more than a simple made appliance that's done by a professional.
Yeah.
So you have to weigh the cost and benefit, right? If we're constantly cracking our teeth, we need to get something in there.
Right.
So really nice to have a solution. But not only does it tell me the data, it also helps reprogram the problem.
Yeah.
So one of the earlier questions was asking about, is there a cure for bruxism? The answer is Up until recently, I'd say there's not cures. There are things we can do to prevent it.
Yeah.
In this case, we actually have a device that helps reprogram those muscle activities. And so is that a cure? It's a gray area. I wouldn't go so far as to say that, but it's pretty close.
Yeah.
And so a lot of users, which have experienced a complete reduction or a complete elimination of their bruxism. And that's the ultimate goal, not just to mask the problem,
right?
Just to actually cure the problem.
Yeah, yeah, it's exciting when we can see that.
For me as well.
Absolutely. All right, moving on here. All right, another question coming from Reddit. I've had bruxism for 19 years, but was always too poor to even consider treatment. I'm looking into treatments now and was wondering what you guys would recommend. I grind extremely rough and my jaw and teeth are ruined as a result. I'm sorry to hear that. I've had orthodontic retainers previously for cosmetic reasons, but I chewed through them and broke them. Are there mouth guards you guys recommend or any treatments that you think would help? I've been browsing online for custom fitted mouth guards over the counter and they seem very hit or miss. I also have a very crowded small mouth and crooked teeth and overbite, so I'm wondering what would affect the type of mouth guard I should buy. Thank you for your advice.
Yeah, this is actually a really great question. This one is really, really interesting to me. If you're grinding through retainers and things like that instantly, then that's a problem. We have solutions that can be much better solutions than that. If you can grind through those things, that means you have a pretty serious grinding habit.
Yeah.
So again, the goal for me isn't to mask the symptoms with a night guard or a Brux guard or whatever you want to call it, an orthotic. The goal for me is to give a solution to the problem and to reprogram those muscles. One of the problems that people run into when they have crowded teeth or crooked teeth is we have to cover those surfaces with acrylic, with a real night guard.
Yeah.
And when we do that, it makes some people feel claustrophobic because this big piece of thick acrylic in the mouth.
Right.
And so for some people, that may not be the ideal solution. I mean, ideally it protects the teeth, but it goes back to, are we solving the problem?
Yeah.
Are we eliminating the source of the problem? And that's more important.
Right.
Right. There's a lot to this.
There is.
And we should certainly seek professional help, but at the same time, if we have something that can easily eliminate that problem for a fairly cost-effective solution, I highly encourage it.
Right. Well, I'm sorry that you've been having such a rough time for such a long time, but I hope that you find something that helps. And if Zareen is that solution for you, we're here to help. I can say that much. You make me think about something with regards to night guards in general, Dr. Scott, which is that a lot of people end up getting them, but the idea of, but they don't wear them every night. And so I'm wondering, how big of a problem is that? Should people feel guilty that maybe that they're not their night guard they paid hundreds of dollars for is perhaps sitting in their drawer somewhere? And what is your sense of why that is a problem?
Couple parts to this answer. One is compliance with devices is low. I deal with a lot of the sleep apnea world.
Yeah.
And a lot of people that have sleep apnea, they go and do a sleep study in a medical center and they get a CPAP.
Yeah.
And we know that CPAP compliance is low. And CPAP is just forcing air, for users that may not be aware. We force air into the system to force open the airways, because during an apnea, a patient is literally not breathing when they're sleeping. It's very dangerous.
Yeah.
And the side effects are very significant. And I've seen reports that say the side effect of lack of sleep is in the $200, $300 billion range. So a very significant impact on society because of lack of sleep and production and accidents and things like that. So,
right.
So big deal. So because I see and I talk and I teach
$200 or $300 billion. $200
or $300 billion US dollars. Yes.
Wow.
And that's just the U.S. numbers.
Yeah.
So
that's a major impact in people's lives.
It's second only to heart disease, just for reference.
Wow.
Okay. So it's a very significant impact. So clenching detracts from sleep. We don't sleep as well when we're clenching at night because we're stimulating muscles. It's stimulating brain activity. All these different things are happening. So sleep apnea isn't, clenching and grinding isn't just about wear on teeth and sore jaws. It's got bigger impact than that too on socioeconomic costs. And so we have to kind of factor all that in. Remind me the other parts of that question too.
Yeah, I guess I'm wondering why compliance, in your opinion, is difficult to achieve with a typical night guard, and how good is that solution, I guess?
Yeah, so it goes back to the sleep apnea and CPAP.
Yeah,
compliance is low because most people don't like wearing a big face mask when they're trying to sleep. Number one, it's bulky. If you're a side sleeper, it makes it more difficult.
Yeah.
And so a lot of the compliance with CPAP ends up with the CPAP on the floor, and then people just put it in their drawer and they don't use it. Well, obviously it's a very expensive piece of equipment, and we just don't get the benefit from it. So compliance is low. There's other oral appliances we can make. The compliance on those is actually higher than it is with CPAP. However, a lot of people end up just putting their night guard in a drawer after 2 or 3 months for many reasons. One is it's bulky in the mouth, and so some people just don't like that. For some people, it actually makes their condition worse. So they may be experiencing more pain in their joints. They may wake up more tired, and that's the sign of an ill-fitting night guard, by the way.
Got it.
If it's made correctly, it should be okay. But if we have devices, again, that are lower profile, that are easier to wear, that maybe aren't just trying to or protect the teeth, that actually can be a deprogramming unit to give us biofeedback, I think the compliance on those is much higher. And we can just take them out if we feel like we're doing good, or if we feel like we're reverting, we can actually put it back in.
Right. So. Yeah, we're really trying to understand this issue at Zerine, because again, our goal is to make as many people have like a better, make a small or maybe big improvement in people's lives, in as many people as we can. And so we're trying to really understand how to help people comply. One of the things that we found anyway is that we do provide a lot of data to our customers on what exactly is going on every night. So, it's the idea is that if people can see that they're like having a benefit, they're having, they're doing something that's helping themselves, right?
They're seeing the benefit.
If they're seeing the benefit, right, and it's daily, like they could see daily what's going on and why, wearing something may be benefiting them. At least for some people, I think that's motivating. They're like, okay, I see the effects of my effort here.
Yeah, absolutely.
So we're trying that to help. Also, and again, you'll have to consult a dental professional, and everyone's different. But there is, with the Zerine product, the effect does not go away. It's not like while you're wearing it. In the sense that, like, if you deprogram it, that deprogramming sticks around. It has some durability.
That's
so awesome. What we're trying to do is provide people a little bit more space to, if they forget to wear their mic guard or whatever else, like, they're
still going to be protected.
Still be protected to some degree.
Yeah.
So we're trying to help that problem. It's a tough one because it seems to be something that we got to get better at solving somehow.
Well, it's a tough one for many reasons. One is I personally believe there's a psychological component in bruxing and grinding, and And so the stigma that comes from that for a lot of people is kind of it's frustrating.
Yeah.
And yet, if we can overcome that, and if we can get them to a place of confidence, it makes them much more relaxed. There's less anxiety. Because, I mean, honestly and frankly, when people go to bed, if they know they're bruxing, they're not going to be like super excited to go to bed because I know I'm going to grind my teeth again tonight. It is what it is. But so if we can reduce that anxiety, people sleep better. They look better. They feel better. So it's actually a really deep solution. It's not just about teeth. It's much bigger than that.
Right on. Cool. Thank you.
Yeah.
All right. Let's see. We got a few more here. We'll take. All right. Well, this is an interesting one. So this comes from Facebook. So this comment, it goes like this: not a fix, but my front teeth grinding is so bad that people literally ask me to stop because they can hear it. I used ChatGPT for some quick fixes and suggested these. These definitely help me, and I'll explain what these are in a moment. They definitely help me not grind, and I noticed less face pain by the end of the day. Only problem, I chewed through all of them already. And they have here these jaw exercisers. They're silicone jaw exercisers for sharpening the jawline. So I'm not really sure what your thoughts are there, but anyway, that's a comment from a user.
I definitely have an opinion on this one.
Okay. Yeah.
Some people actually refer to this as the Hollywood jawline, right? With this muscle here. We see this in action movies, like the hero's got this really strong. We call this the masseter muscle. And Brad Pitt famously does this in his movies. He clenches his jaw and flexes that muscle.
Yeah.
And even my son thought, oh, that's kind of cool. I want to look like that. Well, here's the problem. We're actually flexing a muscle that wasn't designed to be flexed like that. And these little jawline improvers are like a chew toy. So again, it's not just that we're improving our jawline, we're actually putting stress in a joint. And so our jaw joint has a little protective pad, if you will, that fits on the end of the joint. And if we're clenching all the time, that disc can't stay there anymore. So it either gets retracted to the back or it gets displaced to the front or sometimes to the side. We see that as clicking and popping noises. That's that disc either popping back onto the joint or behind it, or all kinds of different things that can happen there. And so for people that would use a product like this that's trying to accentuate the jawline, the problem is it's a chew toy and it can actually damage your joint over time. So I would encourage people not to use that as a solution because, again, we're just stressing a joint.
Right.
And over time, it will create damage. And I've seen this over and over in many people to the point where the joint starts to erode. At that point, our options as dentists are limited.
Got it.
Because we've done some serious damage. It's just like continuing to run on a bad knee.
Yeah.
It's just going to lead to bigger problems.
Got it. Yeah. It seems like it's a tale of caution here, to use such products if maybe causing more damage than
maybe causing more damage. And again, this is like the mouth guards that are the boil and bites that are the cheap over-the-counter ones. It's the same thing. Yeah. It's a softer material that allows us to chew all night long, and that constant flexing in the joint can lead to damage.
Got it. Thank you. How could care be different for dental professionals if they had the data that Zareen provides?
Oh, love this question. You know this about me because we've known each other for a while. I'm kind of a data nerd.
Yes.
I like data.
In the best possible way.
Admittedly, I'm a data nerd. It's hard for me to treat a condition if I don't have data. I couldn't treat a cavity, I couldn't treat a jaw joint, I couldn't treat any of these things if I didn't have x-rays or images or data to tell me what's happening. And so the more data I have, the better the treatments I can offer. because I wouldn't want to do surgical procedures with blinders on.
Fair.
And we're just not going to get the same outcomes. And so the more data I have as a clinician, the more tailored I can make the solution. When it comes to something like Zerine, if I see the data and I can see the patterns and I can see when my patients are clenching, I can provide a much more effective treatment outcome. And it saves us all the time and money of trying things that just don't work for that patient.
Right.
So it's a money saver in the long run by big numbers, but it also, the sooner we can address the source of the problem, the more we can mitigate or reduce the damage in the long run.
Makes sense.
That means cracked teeth, that means jaw joint disorders, that means popping, clicking, pain, headaches, all those things, neck pain, all these different things that come from clenching.
Right.
So data for me is key. I love it. And I love to be able to see that kind of stuff.
Yeah, and at Zerine, we're working all the time to get more data and give it back to our users so that they can distribute it and apply it in their own life. So we're trying to get more data out there so people will feel more informed.
I love it. I appreciate it. I respect it. I know what it means for me as a treating person, but more important, what it means for a patient or somebody that's going through this.
Definitely.
Because that's the ultimate answer, right? This isn't about me. This is about the patient and the
Absolutely.
patient experience. And offering a solution.
Well, Dr. Scott, thank you so much for your time. This has been really fun and informative. I'm sure those out there will appreciate your time here and for answering the questions. And so until next time, thank you again.
Until the next time we're in a hotel out in the middle of nowhere. Who knows where we are today? Just for full disclosure, we are in Phoenix today, and it is raining in Phoenix.
That's right.
In the desert of Arizona. Who would have thought?
Yeah, exactly.
But as you know, I travel across the U.S. and around the world teaching joint and jaw joint and sleeping and lasers and all these cool technologies that we have today. And so for us to be able to catch up in the middle of Arizona, just because that's the way it goes, it's great.
It's great for me
too. And I value your time, so thank you.
Thank you, Scott. Awesome. Thank you.